Hey, welcome back, folks, to Telemedicine Talks. This is Leo Damasco with Phoebe Gutierrez. Welcome back. Happy to have you back. I am super stoked, super excited to introduce our next guest, a powerhouse, I think, in the telemedicine community. This is Dr. Cheryl Lee. She is a board-certified dermatologist, CEO, and founder of Zōca and CLMD. It's her dermatology virtual care website. Check it out. She has expertise in skin barrier biology, and she has developed innovative hypoallergenic products to maintain skin health. Now, in terms of telemedicine, she is a serial entrepreneur, former NIH scientist, and a practicing physician. Thank you so much for joining us. Happy to be here and happy to be able to pick your mind. So thank you.
Yeah, it's fun to be here.
Yeah. So looking back, you're a dermatologist, right? Board certified dermatologist. We've said that, but we talked about this before we actually went on. I've talked to a bunch of different dermatologists about telemedicine. And when I was starting out, talking about this to different people, there was a few dermatologists that I talked to that wasn't necessarily sold on the virtual health dermatology piece. They're like, how can I do dermatology virtually when I need to be in front of somebody physically because it's such a personal specialty? So how did you get to where you're at, basically? How did you get from, brick and mortar dermatology to this powerhouse in virtual health?
Yeah, so actually started in virtual health back in 2014. So I'm a pioneer, okay? Yeah. And I did a clinical research fellowship at the National Institutes of Health. And when I was there, I was focused on people who have a disease called Job syndrome or hyper IgE syndrome. They have all kinds of problems. There's a reason the syndrome is named after Job in the Bible, but their worst problem is the worst eczema in the world. And I got to be really good at managing these really bad cases of eczema and had no good products. And I decided one day I'm going to create the most correctly engineered skin barrier optimization technologies for people who have sensitive skin. And that's all humans, right? I also specialize in chemical allergies, so allergic contact dermatitis. And anyway, spent about 5 years developing this technology. We just got our 5th patent on it, by the way.
Wow, congrats.
And launched it in April of 2014 with a Utah mommy blogger. I didn't even know how to send a text message back then, okay? I literally remember sitting in church one day and someone was sitting next to me, showed me how to send a text message, right? So this is back then, right? Anyway, so I launched the skincare line, and within 3 days, we had people literally from all over the world emailing photos of themselves and their kids to my sales guy, asking him to ask me to diagnose and treat them over the internet. And it was actually a picture of this baby from Algeria, this little 2-year-old, probably about a 2-year-old baby, covered head to toe in scabs and, really severe eczema. And I was like, eczema is my superpower. What if we could unleash my superpower, but what if, Leo, we could unleash your superpower and everybody's superpower and make it accessible to consumers? What if we could make it so doctors and pharmacists and patients could talk to each other? What if the psychiatrist and the primary care provider could collaborate together? What if the specialist and the primary care provider could talk to each other and get your problem resolved in seconds? That's what we need to do, right? And so anyway, that's where my brain was going when all these pictures were coming in. And I turned to my husband. I'm like, I know we just launched a company 3 days ago, but we need to launch another company. And so we started working on Zōca. He's like, no. And I'm like, yes, we have to. It's like so good. You just have to. Anyway, so that's how we started. And people think, oh, you're a dermatologist. Then it's just teledermatology that you do. And the whole ecosystem. It's all specialties built around the consumer. However, dermatology, of course, is my specialty. So we do a lot of super specialized stuff in derm, including we recently launched a dermatology fellowship program, and which we've tied into the technology. And it's something that's been really, really fun to do.
No. And when you mentioned this earlier, definitely interesting. And this has amazed me, right? Because I going through the telemedicine space, I was always wondering, hey, when are we going to go to that next step and create educational pieces? And when you look in medical schools, do you know of any medical schools that have a telemedicine course or teach their med students to get there, right? And
nope.
And we're obviously there, right? The need is there. There's a market. It's going to grow. It's never going away. And this is the next obvious step. And so I was actually wondering to myself, hey, when is this next? And we're there, right? Zōca has created there for dermatology. Tell us more about the thought behind it and just kind of how you educate and kind of the progress of that.
Sure. Yeah. Okay. So I've got my skincare line, right? And the skincare line, it's called CLMD sensitive skincare. And it is really protocol driven. We have specific conditions and we've created protocols where you combine prescription compounds with the over-the-counter products for all kinds of conditions. So atopic dermatitis, allergic contact dermatitis, perioral dermatitis, seborrheic dermatitis, hair loss, psoriasis, all of these things that are really hard to treat, that we are optimizing skin barrier biology using these technologies. But I'm the only one that knows how to use them. And I'm like, that doesn't do anybody any good. Okay. What if I could teach all of these other doctors these superpowers that I have? It's very logic driven and it works very, very reliably over and over and over. And your patients have amazing results. What if I could share this knowledge? Right. And I actually had a job out for my practice. I have a brick and mortar practice also. I had a job out earlier this year looking for a dermatologist or an experienced nurse practitioner. And, put it up on Indeed. Within 2 weeks, we had 150 people apply to the job and 0 of them had any experience. Well, I worked in a med spa for a month. That is not dermatology, right? And so anyway, I was like, if I have this problem, then every single one of those 150 people who want a job in dermatology have this problem too, right? And how can we teach them at scale? And I'm like, well, I have a digital health technology platform with a learning management system and all of the automation and everything already built. So let's start a fellowship, right? Why not? Right. And so that's what we did. So we launched it in April. We have almost 100 fellows already now.
Really? Wow. That's amazing.
Yeah, we've got mostly physicians, actually, a lot of nurse practitioners and a couple of PAs. And it's a year-long program. So if you want to learn dermatology, and our goal is to teach you dermatology so you are actually proficient in dermatology. Okay. So you could go get a job in dermatology, so I would hire one of my fellows to come work at my office. Okay. And so anyway, our goal is to give you enough proficiency so you can go get a job in dermatology or incorporate it into your practice. But this is the digital health spin on it. Okay, so there's a couple of digital health spins on it. We're leveraging the digital health technology, first of all, so it's like you're in clinic with us. Okay, so you see live cases. Okay, what is this? Why do you think that? Okay, what should you do? What should you not do? But we use the application to do that. So everyone in the fellowship can upload their own cases, can ask questions 24/7. Everybody learns from everybody. So in addition to the standard training, process, right? We have, so the fellowship is called Expert Derm. So the Expert Derm Dermatology Fellowship. We also have like a standard textbook review session. You have a weekly reading assignment. We have clinical intensives where we deep dive on, all of these most common things. And then we have the listserv where they can upload all the cases. But the coolest thing about it is, okay, we just taught you dermatology. Now, what are you going to do with it? Well, we give you your own teledermatology clinic and website that's branded to you with telemedicine appointments that cover the conditions that you just learned about and just got certified on. And so anyway, when they do that, they get their own EMR, they get their own website. We cover their malpractice. We provide virtual clinical support staff. So you just show up and see patients. It's designed for you to go use with your own patients. You can obviously use that knowledge in your practice as well, but it's really touching a lot of people's lives and helping a lot of people. And it's really exciting. And we're just getting started. So
no, that's amazing. That's amazing. Because honestly, the dermatologists were one of the hardest people. And to convince that telemedicine is a valid way to practice dermatology. When these people come to you, what have you found as their main kind of speed bump, as their main barrier to actually accepting that virtual care is a valid way? I think it's amazing how you set it up, right? You've set it up where you actually learn in a virtual space and learn how to navigate that and break down those barriers. So it makes it less daunting, right? But, when people come to you, what have you found as kind of the top barrier into adopting this or into kind of just moving forward?
I don't really have a problem convincing people. It's like
they come to you ready.
It's like, duh, okay, yeah, sign me up. You know what I mean? Because it's so logical, right? Dermatology is primarily a visual specialty. Of course, we're not going to cut off a mole, and we're not advertising for you to come for us to treat your moles online. We're advertising for you, the consumer, to get treatment for things that we can treat online, obviously, right? And so I think that's one very important distinction, right? We're not here to treat skin cancer online. We're not doing that, okay? We're not going to cut your cyst out online. We're not going to remove your lipoma online. But we will treat your acne and your eczema and your rosacea, and we'll help you figure out what the heck that rash is and why you keep reacting when you use that Burt's Bees lip balm that you're allergic to, and all of that kind of stuff, right? So there's a huge swath of the dermatology specialty that is very appropriately treated via teledermatology. And, of course, you've got to collect an adequate history. You've got to collect photos and get the story right and be very thorough in that regard. And of course, we've checked all those boxes, right? We've been doing this for a long time now. Yeah. So it's a lot of fun. Have you ever gotten any training in derm? It's your peds emergency med,
I'm
right?
peds. Yeah. So I'm general pediatrician, right? And I was a general pediatrician first before I was an emergency doctor. So I'm dual boarded. But in general peds, we see a lot of dermatology, right? I think secondary to the dermatologist itself, I think pediatrics see the most derm in terms of that sense. And so we got a good amount of dermatology, and it's basic, it's probably compared to the full, but yeah, so that's the training I got. And so it's funny because when you talk about the visual kind of diagnoses and that, so I was in the military before, right? And in the military, parents would be all over the place, right? I was stationed in Korea, and I was the main pediatrician in Korea, and I would get consults from different areas in the peninsula, and a lot of them were derm. Hey, what do we do with this rash? This is family medicine doctors, so forth and so on. We didn't have a dermatologist, so I was the de facto dermatologist at that time. And so so that was kind of my experience.
Yeah. Well, we found just teaching people the basics of, we had a case in the listserv today, a 2-year-old who has severe atopic dermatitis. We gave him our protocol. He's all clear on his body, but now he's got cracks on his feet. Okay. So I upload the case. Okay, guys, what should we be thinking about? And one of the fellows said, okay, I would put glue on the cracks. No. Okay. So the reason his feet are not healing is because he has shoe dermatitis. He's allergic. He has an allergic contact dermatitis. Anyway, so it's really fun to guide these people and help them. Wait a minute.
Amazing.
That way you've been thinking is not the way you should be thinking. Right. And giving them the skill set to solve these things virtually.
No, this
really
is
fun.
great because you're leveraging, like you said, you're leveraging your expertise where, before this, right? Unless you or in frequent contact of you, there's really no way to do that. But reaching out to literally the entire world. Now, the doctors that sign up for your fellowship, are they dermatologists? Are they general practitioners, pediatricians? What are you seeing? And you said there's nurse practitioners, PAs as well too, right?
Yeah, so it's primarily, mostly physicians and nurse practitioners and a couple of PAs. But we've got family medicine, we've got emergency medicine, we've got pediatrics, we've got endocrinology, we've got psychiatry, ophthalmology, people who, all of them see skin, right? Like every single one of their patients has a skin issue, right? That currently they're like, I don't know how to help you. Most of them are like, I just want to have proficiency, like basic proficiency in dermatology, right? And anyway, a lot of dermatologists are very, threatened by what I'm doing. What, you're going to disrupt the whole dermatology monopoly. And I'm like, guys, we don't have a monopoly on this knowledge, okay? And there is very much a shortage in this service, right?
Oh, absolutely.
And you shouldn't have to wait 6 months to go get your acne taken care of, right? And so anyway, and in reality, it is resulting in more referrals to dermatology because these doctors now know what they're dealing with and what they can and cannot manage, right? So it's actually beneficial for the dermatologists and the family medicine providers at the same time.
Yeah, no, I was just about to say, because, you talk to the average ER doctor at least, right? And when we see a rash, it's either, hey, throw a steroid at it or throw an antifungal at it, see what happens. And in 2-3 weeks, if it doesn't work, throw the other thing at it. And if that doesn't happen, if they see us again, then they go see a dermatologist. But now it's nice to have the knowledge of, hey, this is kind of the protocol to go through. This is what to look for, instead of just throwing things at rashes and see what sticks.
Exactly.
No, this is a valuable service. Wow, this is amazing.
Yeah. Well, and just to add, like, I really like that you're tying in the business side of it, because
Yes.
a lot of the people that I work with, PAs, NPs, different physicians, they're perfectly fine going back and doing the clinical training. If you try to teach them like what EHR to pick, oh my gosh, their mind blows. And so like you're really simplifying the process. In the tech world, it's called like a business in a box model. And they don't have it for dermatology. They have it for med spas and other types of scopes, but like nothing that's, kind of like as specialized as what you're doing. So it's really, really cool.
Yeah. Well, thanks. It's been a lot of fun.
And the business aspect of it, you said, you set them up with an EMR, a clinic, so forth and so on. Do you see a lot of doctors, or are they having a hard time trying to get a handle of that scope? Now you're introducing them into the business of telemedicine nationally, right? Is there certain things, certain aspects of national virtual care that these physicians are having a hard time understanding? We talk about things like, the rules, each state rules, compliance, so forth and so on. Just things that you don't see necessarily in brick and mortar practice, right? Things you don't take for granted
Right.
because, well, you're only in that one location, things like that. What have you seen as kind of common questions for you?
Yeah. So, I mean, they all will have a question. Well, can I see patients in all 50 states? No. Right. I mean, we start with the basics, but that's actually part of the fellowship. Is we actually have telemedicine regulation training, how you do telemedicine. It is built into the fellowship. But that, one of the main questions is, okay, how do I get licensed in all 50 states? Or how do I get more licenses? And can I just go see people everywhere? And we educate them. No, you can't. Our software, manager just does that automatically. So you don't need to worry about it, right? Because you put your licenses in our system and you're only going to see people in the states where you're licensed.
Yeah.
But they do have a lot of like the, well, how does the pharmacy work? And how does all that kind of work? But it's all, it's all built in. And you're right, Phoebe, it is a business in a box situation. Yeah.
Yeah. The compliance side is always something that I think it just hangs people up. And so being able to train the clinical brain on that, I think is something that's just really valuable, even outside of just, if you want to scale up. And it's really important to understand like even how to find the rules yourself.
Mm-hmm. Yeah. Well, and we've made it like, they don't even need to worry about that part, right? Like that's all automated and built into the system by default. So, it's like, of course, we're not going to let you see a patient that, the system is not going to let you see a patient that you legally cannot see, so they don't really even need to worry about that part. And then also we manage can you do a video visit in that state or just an asynchronous visit in that state? All that kind of thing. Our system manages that automatically as well. So because they don't know that, right? They usually have most of these people are new to telehealth and they don't understand, oh, I can't actually do an asynchronous visit in my state. But yeah, there's still a couple states that you can't. We help take care of all that too.
And you're talking about Zōca, correct?
Yeah. Yes.
Yeah.
Mm-hmm.
No, that's amazing. And we were talking about this too. So we talked about this earlier. So Zōca was one of the first platforms I kind of signed on as a telemedicine doctor. Mm-hmm. And so it's not just a dermatology platform, right?
Right.
Can you mention, you were saying it's basically its own environment, right? It's whole. Mm-hmm. What does, building that out, I never knew that Zōca was basically built out of this dermatology need. Because I always thought about it as, hey, I'm able to see patients no matter what, and there's a lot of different specialties under. How is building that and making that jump from, brick and mortar to building this big powerhouse of a telemedicine company?
Oh my gosh. Like, can I just tell you how many thousands and thousands of hours that is? Like, it has been a lot of work, right? We have an engineering firm. I threw myself into the tech. I learned tech, and I had to, right? It's like to translate, okay, I need the software to do this. Okay, so that means I have to go talk to the engineers and translate, clinical workflows to the engineers. But yeah, what we have done is built out a full digital health ecosystem. Our goal is to create a comprehensive healthcare solution for consumers where you can get all of your care in one app, and where all of your providers can collaborate, communicate, share records, and really deliver the most efficient care. We've become deeply involved in at-home diagnostics, because you can really push the limit of what you can do with telehealth if you have lab data. And if the patients are anything like me, I mean, the last time my doctor ordered lab work for me, it took me 3 years to go get my blood drawn. It literally did. And so I'm like, okay, I'm just gonna take one of those test kits I have on the shelf. That's how I get my blood work done now, right? So, because I don't have time to go to the lab, none of us do, right? So, but being able to integrate, laboratory diagnostics into telehealth really, also enables us to do this and connect more specialties and provide more value to the consumer.
Yeah, no, and I'm looking at the website right now. You're right. This is kind of a complete answer. And the at-home test, this is very complete. It's very inclusive. You have cardiovascular health, women's health, men's health, just all the above. And you're right? It took me 2 to 3 years to actually see my PCP and actually get those tests. I knew what they were going to say. They were horrible. But it was like, hey, it took me a while to do that and get on it. So, no, this is great. So where are you seeing where telemedicine can be in terms of, you're building out this fellowship? Where do you want us to be in terms of not just dermatology, but telemedicine in, let's say, a decade from now? More educational programs, ingrained in med school, so forth and so on. So what if you would build an ideal world and how to build this out, and where do you see us going?
Leo, I honestly, I was, just reading online, blah, 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 med school closed, fellowship program closed, residency program closed. They're losing their funding.
Oh, yeah.
Okay. I think education is going to go online. A lot of it is going to go online. And this ability that we've built to collaborate and learn other providers, you can do it online. And yeah, you can come to clinic with me. We're connected via video. And I'm going to show you how I do the Kenalog in this patient's scalp and why I, do it this way and not that way. Like, you can do that virtually. It's amazing, right? And 5 years ago, never even thought about doing this. But now I'm like, oh my gosh, this is such a great way to learn. Because you can learn more than just your one attending. You can learn from an entire group, right? And get everyone's perspective and everyone's cases, right? We get the craziest, greatest cases, like I don't get those walking into my office, because I'm a practice, I have just this practice, but you're seeing those patients, we had one of our fellows submitted this case of acne conglobata, which is like the worst acne ever, right? And, I'll see that very, very rarely, but here one comes in through the app and now everybody gets to learn from that. You don't have to wait 20 years in your career to see one case, Anyway, so I think the future of digital health, not only, of course, we're going to be integrating AI in every way, every aspect possible. Diagnostics are going to be tied into AI, but education is also going to be tied into AI. But I think nothing will ever replicate having a human actually talking to you. Of course, nothing will replicate a human touching you, and we're not doing that virtually, obviously, but that's the whole different story. But being able to have someone who is connected and personalized, but also having a support network for, okay, I don't know how to do this. Oh, great. I have 79 people I can ask right now and get an answer, right? 79 experts that actually know the answer to this question. That I think is part of the future. It certainly isn't all of the future, but I think it is part of what is going to make the future.
Yeah, no, I agree. I think that's the power of this. And once we're able to harness this power and able to actually just spread the accessibility of it, right? I think you're right. We've basically just touched the tip of the iceberg here. And once we get all on board, standardize it, protocolize it, and just having the thought of being able to just work with each other, right? Instead of against each other. Yeah, you're right. Just able to leverage our collective knowledge across the board. Now, once COVID hit, did you see a big jump? You said, hey, you didn't think about this 5 years ago, and that's around the COVID time. Where did you see, was there a transition for you there too? Did you see a technology boom? Was it just more acceptable? Things like that.
Yeah, so we actually started out as a SaaS model, and we started building the company in 2014. We saw our first patient in June of 2015. And that's kind of an interesting thing too. I'll tell you about that in a minute. But we started as a SaaS. selling telehealth software and secure messaging and membership management. We have some of the most robust membership management technologies ever, because we started way back then. But we quickly realized, selling to a doctor is like trying to get him to get a new wife. He's like, I don't care about the patient experience. I'm just getting paid by the insurance company. Why should I invest in doing something different? Right. And so that's when we pivoted to the tech-enabled services model. So we started doing that in 2016. We filed some patents. So we have some patented IP on the way that we're able to create digitally connected networks. That is very, really cool. But anyway, we pivoted to tech-enabled, and then COVID hit, and COVID was a huge pivot for us. So we ended up becoming one of the largest COVID test proctoring and COVID compliance management systems in the world. We were proctoring 15,000 tests a day, so we were partnered with all the global airlines, Delta, Virgin, WestJet, Swoop, Alaska. We were one of the health passes for Hawaii. We would help people get out of the Hawaii purgatory when they would get stuck because they didn't have their COVID test in time. Anyway, so that was a great experience on how to scale a tech company, right? We went from 30 employees to 645 days during the pandemic.
Wow.
And it was insane. When we launched Costco, I was on vacation, but I never go on vacation, by the way, because I'm a workaholic. But anyway, I was on vacation, and I remember I went to bed and I thought, I think I might have a stroke. Like, I literally thought I might have a stroke because it was so much connecting all that, you think you've thought of everything, right? And then you launch it. It's like, we didn't think about that. And then fixing it as fast as you can, and that is totally normal with technology. That is the evolution and the life of technology, right? And I now know it's like, okay, that's normal. Okay. You can never think of everything. Anyway, I'm kind of going down a rabbit hole, but that's kind of been our journey. Then after COVID, we went back to what we were building in the very first place, right? And it was nice because then we had funding, right? We call that our equity-free COVID funding round, that financed what we were really trying to do, and that is to build this fully connected digital health ecosystem that's built around the consumer and around the provider. And I always very careful to say and around the provider, because both parties are 100%, the provider experience, user experience, and the patient's user experience, both are equally important, right? If if the tech doesn't work and it's a pain in the butt, the providers aren't going to do it. If the patients can't get the care, they're not going to come, right? So you've really got to marry both sides.
Actually, that's a good point, because I've been involved in companies that are either very tech and patient forward heavy and kind of forgotten the provider experience, or the other way around, right? And it just doesn't work, right? And actually, we've had prior guests kind of making that point as well. Hey, the most successful companies are the ones that take the provider input and build it into their tech, build into their processes, and work very closely with the provider. So doctors right now trying to get into telemedicine, thinking, hey, what other things I could do? You could be these people, product management, product consultants, to help most of these tech companies that honestly it was built by a doctor, so it was inherently provider driven. But most of these companies are not inherently provider driven, right? They're tech driven, created by, tech folks or, just entrepreneurs, not necessarily deep into medicine. So this is where you could find a role in yourself, and you're very valuable doing so.
Absolutely. And you brought up product management. I never even knew what product management was before I started this company, right? But it's really fun. It's like one of the most fun things. And I think physicians inherently, if you're a techie physician, go look at product management, because you get to create and innovate and, solve problems. Physician brains are built that way, so anyway, but having clinical input in building digital health technologies is a must, because unless you have been in the clinic seeing patients and understand the whole workflow beginning to end, and all the prior authorization and the insurance company and the scheduling and the rescheduling and the time zones and all of those things, if you haven't been in those weeds, it's not going to work.
Yeah. And did you have any specialized training in this?
I have a self-administered PhD. Like, I have 10 PhDs.
Right. It's funny because we talked to a lot of different doctors, and that's one of the major speed bumps is like, hey, I wasn't taught this. I didn't have any formal education. I don't have an MBA, so forth and so on. But yeah, most of the people that we talk to is like, yeah, I've educated myself. I've gone through the trenches, and just like you were saying, tons of hours, and there's probably a lot of trial and error, seeing what works, seeing what doesn't, and teaching yourself the terminology, the processes, so forth and so on. And it's funny, who's our last guest talking about, doctors transitioning to product management? Honestly, I didn't know that was a thing either until talking to our guest last week. And I had to look it up and look up kind of different kind of opportunities there. And it just kind of blew my mind. It was like, yes, we are definitely, this is right up our alley. This is what we do almost day in, day out. A lot of us, when we go through med school, we go through our different clinics, whatever you're at, and we're always constantly, I think this is just who we are and how we're trained. We're always constantly trying to figure out ways to do things better, right? Learn the processes, so forth and so on. And that's just what product management is, just in a more entrepreneurship scale.
Leo, I have a question for you.
Yeah.
I have a question for you. What do you think is going to happen to the future career of a physician?
Oh, that's a good question. I'm usually the one asking the questions.
You brought that up because it's like, with AI, the advent of AI, and it's like, man,
that's interesting because I was thinking about this too. AI, we're taught to be thinkers, we're taught to be doers, right? But we're also inherently, managers, supervisors, so forth and so on. I think AI is going to take a lot of the mundane, a lot of those day-to-day processes that we do every day, right? You could see that in dermatology, how AI is in dermatology, radiology, a lot of different processes, ER even, right? But I think what as doctors and as a whole, that we need to be able to shift. We can't totally depend on AI, so we need to keep that leverage, right? We need to keep the supervision over it and be able to dictate it, right? And use it to make our processes better and more efficient. But also, you're right, kind of delving into more kind of product management, using more administrative processes, which we've given up in the past, right? This is why we are no longer the heads. We are no longer the CEOs of hospitals, right? No longer, the leader in healthcare that we once were, because we've given up that leverage. But if we get that back, especially in the telemedicine space, because I think this is going to be a larger percentage of how we practice medicine, right? I think the writing's on the wall, right? Brick and mortar will always be around. It always has to be. But
yeah,
I think the more day-to-day and the more bread and butter stuff is going to move over to virtual care. And if we are able to stay on top of that shift and not shun away our leverage and our expertise, I think, we'll be able to basically stay in the business and not have, decisions be kind of transitioned out. So if that makes sense.
It's pretty crazy to think about. I think, what do you think is the end game in digital health? I mean, you're kind of in the same boat as I am, right? You've been doing this a long time, and you've worked for a bunch of companies, and you've experienced so many workflows and seeing so many innovations.
Yeah.
And anyway, I know you're supposed to be asking me the questions, but
no, this is good. This is good. So I think the end game is going to be the overall end game in health. Why we got into medicine for most of we, right? I'm going to generalize, is helping others, right? Is taking care of patients, right? Is being able to care for patients and their ailments and whatever specialty they are, right? We are, and do that. I think the telehealth end game is being able to do that in a larger scale, do that, and to provide access to populations that haven't really been accessed before or poor access. It's really just doing that in a more accessible scale. So, and I think the companies that I've seen have been successful in doing that is the ones that have been providing access, whether it be, you see a lot of these direct to consumer companies, that access is very specialized access, very specialized complaints, disease processes. But I think they're successful because, yeah, the patients are able to see a doctor, right? Get their ailments taken care of in almost a keystroke, right? So I don't know what you think. When, you've been doing this a lot longer than me. You're one of the OGs, right? So what's the end game you think? And where are you going to see us?
So many things. Integrating image analytics, diagnostics, genomics analytics, integrating them all into predictive algorithms. I think ultimately physicians will do very little decision making in the future. Not decision making. I think physicians will do less reasoning.
Yes,
I should say.
that's it.
Because the AI will be doing like the preliminary reasoning and giving you, okay, here's the 4 things that you need to think about and make a decision. Right.
I agree.
And
I totally agree.
That's,
and we're seeing that now.
What's that?
And we're seeing that now. No, that's interesting you say that. Because I don't think you're right. It's the reasoning, not the decision making, right? Because honestly, do you think decisions will ever be taken out of the final decision making process? An actual person? I don't think so.
Well, I think patients will use AI and they will rely on their physicians less frequently. I mean, I'm already seeing that.
Actually, being in the business meetings with the business that I'm the telemedicine business I've been a part of, that's actually a big question, right? What is going to prevent the patients from going to ChatGPT and ChatGPTing their medical issues versus going to us, right? Like, why are they going to pay for a service when they could go to ChatGPT for free, right? I think the answer is very obvious to me. ChatGPT, is great in reasoning, but when it comes down and you have to actually decide and do things, then that's when we use our vision knowledge to differentiate between what ChatGPT and AI has put forward. Because you've used AI, it's not 100%, right? And it could lead you down a dangerous rabbit hole if you depend on it 100% exclusively.
Yeah. Well, case in point, I had a patient call me today and she's like, well, I don't need my appointment anymore. I asked ChatGPT. And I was like, oh, well, what's going on? Well, I got blah, 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 blah. And ChatGPT told me just to use an antihistamine and that's helping. She's like, but it is spreading all over my body though. And I'm like,
right. No, exactly.
How's it working out for you?
Right. It's like, this is why you hired me, right?
Right. Exactly. But no, I think that concern should be on every one of our minds.
It should. You're right.
Right.
It should.
What other value can you provide to your patients? Okay. What is it that makes your service something that the patient does want to come to?
No, exactly.
And is a more sure bet than going to the AI.
No, exactly. And on that hand too, being able to leverage the AI to your advantage too, right? Because honestly, like we see it in brick and mortar stuff too. Let's say you see this very hard case in the emergency department, right? And we look up things all the time, right? But if we pass it through ChatGPT and say, hey, what's the top differentials? It'll get us closer to where we need to be faster, which is better for the patient, right? So like we can't totally just deny AI as a tool, but we can't also depend on it entirely as a crutch. But also being able to protect the profession of a physician, right? So,
yeah, interesting things to think about.
This is actually a good kind of thought pathway here, because as we move along towards this end game, we're not going to deny AI is going to be there, right? We're not going to deny the bigger role of AI. And every single one of us, no matter what specialty you are, and some specialties more so radiology, talking to you too, right? How are you going to provide value, and how are you going to convince people that, that we're not going to totally depend on AI, robots, so forth and so on, right? So I think this is how we're going to protect the profession of doctoring in the future. So interesting.
Yeah, I mean, I think my little 2 cents on it is that I think that what you're building is going to be more relevant than ever. I think people, again, aren't going to go to their PCPs. You're not going to go to your pediatrician. But if you have a skin rash, if you have I think it's going to be in the rise of specialty care, and you're really going to need, more now than ever, physicians who understand longevity and hormones and dermatology and allergies and
nutrition and gut biome and
exactly.
And those topics, right, are just, they're not that very well known, right? And the ability for telemedicine to increase everybody's knowledge, physicians and patients alike, right? And have that source. I think that's an amazing tool as well. So
Yeah, I think
no,
so.
this is great. We are getting close to time, but I do like to ask one question before we go. Thinking back to intern times, right? Day one of intern year, you're able to go back and talk to this intern person. What would you tell your intern self on day one, July 1st? Say, hey, here's some knowledge I can impart to you.
Oh my gosh. I mean, digital health wasn't even like an inkling in my mind back then, right? I mean, I did an internship here in 2000 to 2001.
Oh yeah, same.
But I wish I could have like come and whispered into my head, hey, you're going to start this massive digital health company in the future, and you're going to become a technologist, okay? Like, I would have gone back and studied computer science, right?
That's
I would have
actually
told myself to study computer science and genomics and laboratory medicine. That's what I would have told myself.
No, that's how many computer science majors go into med school?
Well,
right?
I know a few, and they are brilliant.
Exactly.
They
Right.
are
They
brilliant.
are made for this, right? Yeah. And that's actually an interesting kind of take in that. No, that's great. No,
But I
thank you.
think that combination is going to be so needed in the future. But anyway, sorry, go ahead.
Yeah. Oh, yeah. No, it's needed now. It's needed now to further digital health, right? Because, yeah, there is no classes on digital health, digital care, really technology whatsoever, right? And you're right. When we started, and shoot, the biggest technology I had was this big old phone that was the size of a brick, right? And that's all I
I had a
knew.
BlackBerry. I had a BlackBerry.
Oh my gosh. Yeah, you were way more technology driven than me. I had a phone literally the size of this microphone.
Awesome.
But no, before I go down, it's a rabbit hole. No, thank you so much for joining us. Where can we find Zōca, right? How do we get in touch with you through or find your companies? Is it Zōca.com? Is that right?
Azova.com. Yeah. And our fellowship program is at azova.com/fellowship/dermatology if you're interested in a
Actually,
fellowship program.
I'm looking into it too. So, and we'll put that in the show notes. And just to mention your other dermatology line, it is
CLMD.com.
That's right. It's your initials. And if you haven't checked out your
Yes.
Instagram, and please check out the doctor, your Instagram. I learned a lot about
Cheryl Lee.
eczema while I was going
Cheryl
through it, right? No, there was a lot of interesting cases about eczema and whatnot. Definitely useful. I wish I found out about this when I was like a pediatrician seeing pediatric care. I was like, oh, okay, I could have used that. So no, definitely check out your handle. And what was that again? Sorry, I was talking over it.
CherylLee.Eberting on Instagram, and also Expert Derm Fellowship on Instagram and TikTok.
That's awesome. Thank you so much. And Phoebe, any closing thoughts?
No. Thank you so much for, again, I think what you're doing, and I completely agree. I think education is the future, and being able to share your wisdom and train other physicians who could also go and, provide access, because it's just such a huge issue now. I think it's amazing. Zōca is amazing. I've been on the website half the time looking at all the specialty care that you provide, which is just, again, it's so hard to get in, those appointments, and having such a robust network is super impressive.
Oh, thank you. It's been a lot of work. I can tell you that. And it's going to be a lot more in the future. So, but yeah, it's been really nice to be with you guys tonight.
No, we're looking forward to see what else is up your sleeve. Thank you so much.
Okay. All right. Thanks so much. You guys take care.
You too.
All right, thank you.